Everybody. So my name is Lisa Beyer. I'm part of Dr. Wigoda's social media team, and I'm also a patient of Dr. Wigoda's, a very happy patient. And I'm here today to talk to Patricia. Hey, Patricia.
Hey, Lisa, how are you?
Good, good. So Patricia is coming live from Fort Lauderdale, and we're here to talk about Patricia's experience with Dr. Wigoda's painless breast implant surgery and tell us a little bit about her stories. But first, Patricia, tell us about you. What do you do for a living and what do you love to do?
First of all, thank you so much, Lisa, for inviting me. I'm a personal trainer and I also an instructor. I instruct group classes. So my life is always like involving connecting with people, exercising, mindsets. Yes, that is my main job.
Yeah, I was watching some of your videos, your fitness videos, very inspiring to
Trying to
watch.
get everyone motivated and committed.
Yeah, it got me motivated. I want to go work out on the beach when I'm down there next. I'm going to call you. So tell us about what inspired you to look into breast implants and tell us a little bit how that happened.
Okay, so as an instructor, and we are always like oscillating sometimes with weights. And I did one competition, a fitness competition, that I start to realize that the losing of body fats definitely affects your breast. The breast is the first part of your body getting affected. And I start to realize that I was starting to feel a bit saggy in my breast and not feeling so comfortable with myself. So that's why I decided my main goal was more doing a lifting, but I went to Dr. Paul and we talked a little bit, and I thought about, like, besides the lifting, why not also do some implants just to feel the extra skin that I was getting. Yes.
So you originally went to get just a lift and then you ended up getting an implant. So what was your size before and what is it now?
My
Just to give us an idea.
my side was probably a 34 small b, and now is a 34C. Now is a challenge to find bras that.
I was actually the same way. I was like a small 34B, maybe a large 34A, and I went to 34C-ish. So I love it. I feel so
Yeah,
much
me too. I'm
better, so
so
more
happy.
confident.
Def-
Yeah.
definitely, and that's why it's like I was starting to feel okay. I'm a fitness. I'm toned up, but it's something parts of my body that I don't feel 100% confident. So that was the main reason that I start to search for different doctors to see what they had to tell me, what suggestion they would have for my case. Yes.
So tell us a little bit about the research. What did you hear from the different doctors and how did you decide on Dr. Wagoda?
Okay, that is. I probably went to 5 different doctors, to be honest with you. It was my first surgery. So, as you can imagine, in the first moment, it's like kind of scary. You wanna make sure that you are with the right person that is gonna do the right thing. So I asked 4 different doctors, and Dr. Paul Wigoda was completely different in the way that I connect with him since day one. I feel so welcoming with his team. He was very professional. He spent the time to explain all the process. He didn't make me rush to take a decision. He just was there for to clarify all my questions and to help me as much as he could. Mm-hmm. So
That's
that.
great.
Mm-hmm.
And what was it like, when you made that decision? Because I was the same way, actually. It was my first surgery and it was my first time going under, and it's, kind of nerve wracking. And then, they say it's not going to be,
Mm-hmm.
you're not going to have any pain, but you don't really know. So what was that like, making that decision?
Definitely scary, and to be honest with you, even the day before I thought twice, like, should I do or should I not. I'm not sure if I'm prepared for, but just to have, like, walking in the office and have, for example, Maria, a super nice lady. She's like, you are gonna be fine, don't worry, it was the best thing that I could done for myself, and just calm you down, just make you feel like you are in good hands. And I think that was really important for me to walk in an environment that received me so well in such a warming way. So that's definitely.
Oh, that's so nice. So I just want to, since we're live, I just want to let everybody know that we're here with Patricia, and she just recently had painless breast implant surgery with Dr. Wigoda. And if you are watching us live, feel free to put in the comments if you have a question for us. We'll try to answer it the best we can. And if you're watching the recording, still put a question, any questions or comments, questions in the comments, and we'll get back to you and we'll try to answer all of those questions as well. So Patricia, so thank you for sharing your story. So tell us, so you walk in that morning, and how did it go the day of your surgery?
So the day of my surgery was a little bit like the process of waiting, because my surgery was planned to happen at 12. So all this morning was like, oh my gosh, I just want to get it done. I just want to like wake up and that's it. It's done. There is no go back. But so the morning you cannot eat. I went there, was very quick. He did the last like look to my breast, all the measurements, and I was ready to go. And to be honest with you, was at the same time so quick, so easy that I was when I realized already, oh, I'm waking up in the middle of this room and was done. So was not like at all a hard process at all. To be honest with you, Lisa, was quite easy, I would say. And even after the surgery, when I went back home, of course you are still in like under the effects of all the medication, but like maybe the first hour was just like adjusting your body, and I was feeling a little bit like it's not dizzy, but a little bit, you probably felt the same. But
Yeah.
after that, he gave me some suggestions to raise my arms every hour, and I did it. So in terms of pain, I never felt pain. The funny part is like he gave me medication, even like painkillers, and I never had to take it. I took my Motrin and
Oh,
my
that's great.
just that, and the muscle relaxation, like just like to relax. But even those medications I took like for 3 days, and I was like feeling so good after. um in the beginning, it was just like the pressure that you feel, that is normal. And maybe what was harder for me was the lie down, because I'm so used to lie down on my sides when I sleep. So that probably was in the first 2 3 days, not be able to sleep more than 4 or 5 hours straight. But after 2 days, I was driving already. I was teaching, of course, just queuing my clients. Of course, I had the temptation to grab weights, but everyone like, no, 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 don't do nothing.
Right,
But
right.
I felt great. I felt great, and the funny part, everyone that I talk about, everyone's like, "How can it be possible?" Because I was in pain for 2 weeks. And
Same thing. Yeah. People that I talked to that didn't go to Dr. Wigoda, they took weeks off of work, and it was like a
yeah,
month to get back to normal. And for me, I was the same way. I mean, I think I stayed home the first night, but then the next day my husband and I went to lunch and we went to the mall, and I mean,
yeah,
everything was completely, doable.
yes,
And
definitely.
I didn't lose any time whatsoever.
Yes, no, me either. And I don't know what kind of procedures you did. I did the lifting and the implants, so it's a little bit more demanding just do the implants. And that was also something that kind of scares me about in terms of scars, how they're gonna heal. But has been like it's getting so smooth that there are parts of my scars that you can barely see that there is a scar.
Yeah.
And this happened maybe 2 months ago. So the process is getting there, and to be honest with you, I feel great. I couldn't choose a better person. I love him. I really appreciate everything that he did for me, definitely, and the way that
Uh,
he
that
treated
sounds like a great experience. So if you had any advice
me.
for women or for people that are looking to do the breast implants, what advice would you give?
I think if someone is looking forward, I think yes, do it. You have to do what make you feel comfortable. To be in the beginning, or even like few years ago, I had huge boobs, and then with all these lost weights, I lost, and I remember like few years ago saying like I would never do such a surgery. I didn't picture myself doing all this, but your body change, your skins change, everything change. And that's why it's so important for us to be kind of a little bit vain with yourself. It's important for you to feel good with yourself. So if you are willing to do a procedure, definitely do it, go for it, but make sure that you do your search first. Make sure that you are doing with the right person, and make sure that you really prepare yourself for what is coming, of course, in terms of like, okay, my body is going to change, but for me, changed for so much better, and I feel so much, even I think he's even better than I was expecting. So that's what I suggest people to search and to make sure that they are dealing with a good professional, definitely,
Yeah.
that knows what they're doing.
I mean, for me, I feel like I wish I would have done it 5 years before, that
Yes,
I wish I would have done
definitely.
it earlier. That's the only advice I would say is, I was so sorry I didn't do it earlier. I was so happy once I did do it. I feel just so much more confident in everything. But tell us a little about your business, Patricia. So you're a trainer, and tell us about what type of training you do and
So
where we can find you if somebody wants to come to you for
definitely.
training.
You have to come to my classes.
Yes.
So I'm a personal trainer. I've been teaching most of the time here in Fort Lauderdale. I'm from Portugal. It's funny because my background is psychology, but I've been doing fitness for about like 7, 8 years. So since I arrived to Florida, my main job is doing personal training, group classes, and I don't know if you're aware of active isolated stretching on the table. So I also provide stretching sessions to my clients one-to-one. So yes, trying to keep everyone like fit and motivated to exercise and keep like a healthy lifestyle.
Yeah, we all could use that. I need that. So if somebody wanted to get in touch with you, do you have a website that you can tell them to go
Yes,
to, or a blog?
yes, definitely. PA Wellness Coach at gmail.com in terms of email, or Facebook, Patricia Alves, or PA Wellness Coach. You can find me on Facebook as well.
Okay, great. So are you complete with the doctor's visits and everything, or do you have to go see Dr. Wigoda again? What's next?
So he's gonna see me in 2 months.
Okay.
Like I said, like the scars are healing perfectly, and so he's just gonna see me in 2 months. So yeah, all good, and it's amazing to be able to dress like wear some dresses with my back open without being aware or like uncomfortable of the bra. So Lisa, I'm loving this. As you said, I wish I had done before, because really is really important for me to feel confident with my body, because if you feel confident, you will transmit that even for my clients as well. So definitely, yes,
Yeah.
best thing.
It's fun to go shopping, right?
Definitely.
You have a whole new perspective, and you can try on different dresses that maybe you wouldn't have tried on before, and different
Yes.
types of bras and bathing suits. It's fun. I love it.
Yeah, because the old ones are gone.
Yeah, right. It's so funny. Well, thank you so much. And maybe you could share some of your before and after pictures, and we can put them with this post if you're comfortable doing that. Or maybe I saw some of your videos, some of your fitness videos, that we can really see your body and like just give us inspiration.
Definitely. Unfortunately, I don't have before pictures. I will ask Dr. Paul to send me the picture that he has, and I can definitely send to you. Definitely, not a problem.
Okay, great. That would be awesome.
Okay,
Yeah.
Lisa.
All right, Patricia. Well, have a great day, and thank you so much for joining us.
Thank you so much. You too. Have a great day, Lisa.
Bye.
Take care.
Namaste. Bye.